So next, we are going to discuss what to expect after surgery with nurse practitioner Denise Miller. Denise Miller graduated with her master's in nursing and adult geriatric nurse practitioner in 2014 from LaSalle University. She has been with the Department of Neurosurgery since 2008, first working in the operating rooms, Gamma Knife, then as a nurse practitioner since 2014. She has also had a cranial focus and about 2 years ago moved into movement disorders full time. She enjoys meeting patients and their families and providing comprehensive care for before and after surgery.
Thank you, Gabby. Can everybody see my slides?
Yes.
Thank you. So I know that with presentations from Dr. Cahigas and Dr. Q talking about DBS and focused ultrasound, I'm going to try to highlight some of these things, but some of it has already been brought up. But thinking about that this is an elective procedure for treatment of tremor, we do need to make sure that we are taking care of everyone safely to have the best possible outcomes. And so we do have a standard battery of testing that we do before the procedure, looking at cognition and cognitive testing, the pre-procedure imaging, pre-procedure testing, blood work, EKG, and then also obtaining clearances from providers to make sure that it's safe to undergo anesthesia in the procedure. And sometimes we recommend therapy evaluations beforehand as well. So thinking about DBS, that is usually a staged fashion procedure. Stage 1, placing the leads. Surgery could take somewhere between 2 to 3 hours. Usually somewhere between 9 and 10 days later, we place that battery tunnel from the side. There's a small incision on the side of the head and then also on the chest to place the battery. And times we stage that into one lead at one time and then a second lead 3 to 6 months apart, sometimes depending on those cognitive testing before surgery. So thinking about getting ready for DBS surgery, typical preoperative restrictions for fluids and food. You get instructions on medications that need to be stopped safely. We also do try to minimize infection, kind of just using very mild skin products and shampoo. You would use these after surgery as well, just to minimize irritation of the healing incisions for usually 4 weeks to maximize the recovery of those incisions. We also use special pre-surgical wipes before stage 2 surgery to minimize any bacteria on the skin. So stage 1 day of surgery, just like Dr. Q and Dr. Cahigas had mentioned, all the surgeries take place at Pennsylvania Hospital location, either in the main hospital or our short procedure unit right next door. And so kind of just thinking about how you'd spend one night in the hospital for the first surgery, going home. That second surgery would be a day surgery. And then thinking about just how you would feel after surgery, because we're making incisions on the scalp, placing those leads. You could have mild pressure headache, some swelling, bruising kind of in the areas of where we put that frame on, very minimal. You could just feel tired from having the brain procedure for 4 to 6 weeks. Really does vary based on kind of what your energy level and kind of endurance level is at baseline going into surgery. There could be some cognition, memory, or some word finding changes short term. You can definitely see a honeymoon effect after the leads are placed temporarily until it is connected with those extension wires into the battery. You can see improvement in the tremor symptoms, which is great. So thinking about going home after surgery, we typically send you home with a short course of pain medication in case you need it, stool softeners so you're not straining to move your bowels after surgery, and sometimes antibiotics just to prevent infection. And usually you're evaluated at the hospital to determine kind of how you're doing after the surgery. That would potentially recommend home care services, which would include a home care nurse, PT, OT, maybe even some speech therapy. And we do recommend that you take showers every day, washing your incisions, kind of just keeping them clean and dry. Stay hydrated. We recommend high protein diet, anything to help with increasing wound healing. We also talk about before surgery, making sure that if you're diabetic, that your hemoglobin A1C is well controlled. You've talked to your provider to kind of maximize that recovery. And so for which everybody has kind of alluded to a little bit about after surgery, those activity restrictions, because we place those leads for the first 2 weeks. We don't want you bending that your head's lower level of your chest, pushing, pulling, lifting anything more than 5 to 10 pounds. We generally want you up and walking to kind of make sure, just kind of healing from surgery in general, that you don't develop a blood clot, taking nice deep breaths, up and moving around, and that usually about 3 to 4 weeks after surgery, and you can start to slowly increase your activities and resume kind of an exercise routine. But during this process, you're still working with home care PT, OT, and once you're released from them, we do recommend that kind of just proceeding with some outpatient therapy to kind of maximize your recovery. So thinking about just how we manage those incisions, usually there's a wound check where we evaluate the incisions, remove sutures, staples, about 8 to 14 days from surgery. That could be done by our office, could be done by the home care where you're staying at home, or with your primary care doctor. We usually see you over a video visit at 1 month, so we can kind of verify and see over video that the incisions are well healed. At that point, we would let you resume your normal skin and hair routine, and then also discuss if you've been released from home care, doing therapy, recommend doing outpatient therapy to maximize that recovery. And then usually seen back with the surgeon at a 4-month visit, just to check in, because you've been seen by your neurologist for programming in the meantime for a couple sessions. So programming initially 2 to 4 weeks after surgery. And so we often do turn that device on with the second surgery, and that you should pretty much take your programmer with you everywhere you go, just like they had indicated. If you needed an x-ray or you were seeing an orthopedic doctor for a condition, that you could turn your device off, get that x-ray, and then get that completed while you're in that office. So other things to think about is that once you have DBS implanted, that possibly getting a medical alert bracelet to let everybody know that you do have the implanted device, carrying your DBS card with you. We do have special precautions for MRI. We do need to complete a form. Your neurologist who's been managing the device or our team can help with that. There are certain types of medical and surgical therapies that could damage the DBS. And so there are diathermy, lithotripsy to break up kidney stones, and transcranial magnetic therapy. And so normally we do recommend that the DBS device be turned off during most surgery procedures. And we also discussed scuba diving not below 33 feet, and that when traveling, going through airport security, security at the courthouse, that you should be hand searched, safe to walk through the things at the mall. And then usually for the short term after the procedure, for about 3 months, we recommend taking an antibiotic just before invasive procedures, dental work, things like that, just until your body gets used to having the system in place. But we don't recommend lifelong, like they do with some of your orthopedic implants. So thinking about getting ready and after HIFU, the high intensity focused ultrasound, again, takes place in the Spruce building, the short procedure unit at Pennsylvania Hospital. It is a long day till we kind of get ready for the procedure, do the procedure, do a post-operative MRI to verify that target that was created with image guidance, evaluation and recovery by a therapist to see if whether or not any home therapies are recommended. So as we've talked about, those expected side effects being that just fatigue, gait imbalance, speech changes, which could be some slurring kind of weakness, numbness, coordination, and dexterity changes, where you're thinking about kind of retraining your hand and movements that you've kind of compensated for a number of years, depending on how long you've had tremor, and thinking about trying to write and do some of those everyday activities, kind of relearning and retasking. So I know that Dr. Q had shown this as with patient responses on before and after, but we do get real-time evaluation and improvement in that tremor. So we also do prescribe, when we're thinking about the medications after DBS, medications that we use after focused ultrasound is a steroid medication, a little bit stronger than prednisone, which most people are familiar with, just for a few days, 4 to 5 days after the procedure. For the first week, we recommend limiting kind of some activity, no strenuous activity, no bending, just as that inflammation around that lesion that was created diminishes. And then the limitations after that first week are kind of dependent on those side effects from the treatment and how they're affecting your everyday activities. If you are having balance and walking issues, have some weakness, numbness, or dexterity coordination changes, that would impact maybe some of the activities that you're getting back to as quickly, and that making sure we're doing all of that recommended therapy that was recommended. So really thinking about maximizing outcomes, that we really do recommend thinking about those expected side effects, and they vary from patient to patient. We just like to make sure that we're very proactive in talking about that all of that could happen, but varies from patient to patient, and that really doing the therapy and maximizing that recovery, and which essentially after focused ultrasound, depending on how many weeks you're working with home care, and then start outpatient therapy for several weeks, it could could go from 2 to 12 weeks until you complete all of that therapy. And so thinking about how things are going once you're home and when to call our office, by all means, if you fall, hit your head, bump your head, have any changes in new or worsening confusion, worsening headache that aren't relieved with over-the-counter products, we usually recommend just using Tylenol. New or worsening weakness in your arms and legs, that would be in after that initial weakness, numbness that we see from the focused ultrasound procedure, something that significantly changes, getting worse, not better. We expect those to all get better over the next coming weeks. Any concern for infection, swelling, redness, warmth at your incision, any type of drainage, pain or redness, swelling in the legs, especially one, not both. We would be worried about blood clots. That's why we recommend everybody get up, move around. Any fever, temperature greater than 101.5, seizure activity, and then thinking about long-term living with DBS, that if at any point you have an opening, the skin over your device wears very thin, you fall, bump your head, hit your head on a cabinet in the kitchen coming up quickly, that if there's a scab or any open area at any time, our team would want to see you, evaluate that, because we would always be concerned about making sure that all of that is intact and that there isn't any risk for an infection because of that opening in the skin near the device. Stop sharing and see if anybody has questions. I know that we have just a few minutes to talk about questions.
There was a question about the neuropsych testing, if you need it for both DBS and ultrasound.
So we usually do a short cognitive evaluation called the MOCA in the office, and depending on how that scoring comes back, then there might be a time where we would recommend a formal neuropsychological evaluation, but many a times we can do that kind of an abbreviated cognitive testing in the office as a screening before both procedures.
And the other question was about does having pets increase infection risk to the incisions?
So thinking about having pets in your home, just that does not. I think it all depends on that when we think about talking about caring for your incisions with focused ultrasound, they're just little pin spots that over 1 week later, you can barely see that you even had that done. But thinking about permanently implanting a foreign device, the DBS, that during the day when you're towering once a day, the least amount of times that you touch at your incisions as we touch our environment the best, just to minimize risk for infection. I don't think having pets in your home at baseline increase the risk for infection, but I think we have to think about if your animals sleep in bed. I know that some patients say the cats kind of sleep kind of around their head in the bed. I think that you might need to kind of have them stay in a different room, kind of think about those things, just that making sure that doesn't increase the risk that that could possibly be a factor in the healing process. But overall, not usually.